Thank you very much for that. Now, a very good afternoon to you, and of course, welcome to this session of the World Health Summit. Let me remind you as to what the theme is. It is scaling up the integration of NCDs in primary care. Let's start first with the introductions. My name's Juliet Foster. I'm going to be with you for the next 90 minutes, facilitating a discussion that I'm sure will be lively and above all informative. So thank you so much for joining us. I also want to take this opportunity to thank those responsible for making this event a reality. Namely the government of India, which many of you probably know holds the current G20 presidency, India's Ministry of Health and Family Welfare, and the Defeat-NCD partnership. Thank you, all of you, for everything that you're doing now and for what you will continue to do in the future. We are extremely grateful. Now, I'm sure that many of you attended last year's summit, and if you did, then you'll probably remember that delegates reaffirmed their commitment to fighting non-communicable diseases, or NCDs. Also, they promised that they would ensure that lessons learned from the COVID-19 pandemic will be translated into action on the ground. Well, those promises continue to take root 12 months on, and India is among those leading the way. Now, it's more than fitting, in fact, that the world's most populous country is actually carrying the baton forward. Why? Well, at a recent meeting of G20 health ministers in Gujarat state, officials pledged to strengthen the global health architecture and I quote, to build more resilient, equitable, sustainable and inclusive health systems. Integrating NCD treatment programs into scaled-up primary care structures is vital given the urgency of the health crisis. How urgent? Well, worldwide, non-communicable diseases are the most common cause of death and disability. Indeed, they account for 70% of all mortalities, while for those affected, 3 out of 4 years of their lives will be lived with an NCD-related disability. India is a huge contributor to that data, with the world's second largest adult diabetes population, while globally, every 6th person diagnosed with the condition is an Indian. Now, the government's response is the 75-25 initiative. You're going to hear a great deal about it, but let me summarize it. The objective is to put 75 million people with hypertension and diabetes on standard care by 2025. Not long to go, is it? Now, running alongside this are projects designed to strengthen community healthcare services and also the recruitment of additional medical personnel. In short, India is on a journey from which others can learn, and scaling up is key. It also helps to view India's approach in the context of the UN's Universal Health Coverage, or UHC, where countries and stakeholders have the opportunity to reinvigorate progress towards delivering good healthcare for everyone. Universal Health Coverage partners are committed to ensuring that pledges made at the 2023 UN high-level meeting on UHC are translated into concrete action that advances universal healthcare at community, regional, national and global levels. This also explains why for India, focusing on primary healthcare caters to nearly 70% of the population, while providing treatment for between 80 to 90% of common conditions. Now, as India's population surpasses that of China's, there is a growing urgency to build primary health systems that are resilient and equitable. The National Health Protection Mission, which was launched in 2018, is another major step towards providing low-income earners with free access to health insurance coverage. But there are many questions. How can these and indeed other radical initiatives keep pace with the complex health needs of a growing population? And what about the long-term cost? Who should foot the bill for the high-tech, scaled-up systems that in an ideal world should offer a complete diagnostic picture for treating NCDs? And above all, how can local communities be brought into these brave new structures while being given a meaningful say in what happens next? Well, today we're going to hear from experts at India's Ministry of Health and Family Welfare, the Indian Council of Medical Research, the World Health Organization, Dell Technologies, and the Global South Partnerships at PATH. PATH is a global health NGO. Now, each speaker will have 10 minutes, and I'm stressing this, 10 minutes. We have a lot of ground to cover and very limited space. And in that 10 minutes, they will give a speech outlining the impact of NCDs in India and how the government is fighting back through partnerships and technology. To all the speakers, you will also be given a reminder when you have 2 minutes on your allotted time. So you will also be given a 2-minute warning. But first up, can you please welcome our keynote speaker, the Honourable Minister of State and Family Welfare, Dr. Bharati Pravin Pawar from the Government of India. She joins us remotely. So, Honourable Minister, the floor is yours, and you have 15 minutes. You have 15 minutes, Honourable Minister.
Thank you so much. Thank you. Esteemed guests and distinguished colleagues, Namaste. Thank you for the invitation to participate in this significant high-level panel discussion focused on scaling up the integration of non-communicable diseases, NCDs, in primary care. In light of the moderator's introduction on NCDs, India firmly emphasizes the need for a comprehensive strategy in addressing these diseases. This strategy includes preventive measures, early detection, and efficient management with the aim of reducing the prevalence and impact of NCDs on the well-being of our citizens. In line with this objective, the Union Health Ministry, under the leadership of Honorable Prime Minister Shri Narendra Modi ji and guidance of Honorable Health and Family Welfare Minister Shri Mansukh Mandaviya ji, has launched the 75/25 initiative aimed at screening and providing standard of care for 75 million individuals with hypertension and diabetes by 2025. It marks the most extensive expansion of NCDs in primary healthcare globally. Notably, it adopts a community-based approach commencing at the primary healthcare level, underscoring the government's untiring commitment to addressing NCD through resource allocation, capacity enhancement, mobilization, and multi-sectoral collaboration. India's visible efforts to improve social indicators such as life expectancy, maternal mortality rate, and NCDs are evident in its seeking of this goal. The outcome budget document of the Union Budget for 2023-24 is noteworthy for including hypertension and diabetes treatment as output indicators for the first time. This inclusion underscores the government's dedication to scaling up coverage services for hypertension and diabetes, further emphasizing its commitment to tackling these health challenges. Dear colleagues, non-communicable diseases have become a significant global health challenge, causing nearby about 74% of all deaths worldwide. With a similar trend observed in India, where it accounts for 63% of all deaths. India is also experiencing rapid epidemiological change with a steep rise in NCDs. The deep impact of this epidemic affects all age groups, irrespective of gender, socioeconomic status, religion, ethnicity, etc., demanding immediate attention. The Government of India had launched the National Program for Prevention and Control of NCD under the National Health Mission in 2010 with the aim of strengthening infrastructure, human resource development, health promotion, early diagnosis, management, and referral. Ayushman Bharat. Ayushman Bharat is translating the policy intent to budgetary commitment to meet sustainable development goals and to achieve universal health coverage, underscoring the commitment to leave no one behind. Ayushman Bharat has two components which are complementary to each other. And the first is HWCs, that is Health and Wellness Centers, which are being set up to deliver comprehensive primary healthcare services by providing 12 expanded package of services, including NCD service package along with the wellness activities. And the second component is the PMJ, that is Pradhan Mantri Jan Arogya Yojana, which is the largest health insurance scheme in the world that aims to provide a health cover of ₹500,000, that is 5 lakhs rupees per family per year for the secondary and tertiary care hospitalization, including NCDs to over 12 crores poor and vulnerable families. Dear colleagues, the Union Ministry has implemented population-based screening under the umbrella of comprehensive primary health care across Ayushman Bharat Health and Wellness Centers. The individual in the age groups of 30 years and above are targeted for risk assessment and screening of common NCDs, that is hypertension, diabetes, oral cancer, breast cancer, and cervical cancer. The services are being offered to trained frontline health workers, and the referral support and continuity of care is ensured through all levels of healthcare delivery systems. Through eSanjeevani, teleconsultation services for NCDs are provided to citizens by leveraging potential of information technology, bypassing barriers of geography, accessibility, cost, and distances. Dear colleagues, prevention and control of NCDs as well as awareness for healthy lifestyles are being carried out in a mission mode at all levels of healthcare delivery in collaboration with the public and private sectors. Beyond the management of illness, health and wellness centers are focusing on ensuring the wellness and well-being of the community. In addition to this, we have also collaborated with other union ministries and departments, such as Ministry of Youth Affairs and Sports and the Ministry of Ayush, for activities such as Fit India movement and yoga-related activities carried out by the respective ministries. Other initiatives for increasing public awareness and cities for the promotion of a healthy lifestyle include observation of international and national health days and the use of print, electronic, and social media for continued community awareness. Dear colleagues, let me also take you through the digital health technologies initiatives that have significantly improved the management and prevention of NCDs. The National NCD portal is being used for prevention, control, screening, and management of common NCDs. Primary level information is captured through this portal at public health facilities for reporting and monitoring individual-wise screening and compliance of treatment for NCDs. It also features a single longitudinal health record for every individual in the cloud, identified by a unique health ID, that is ABHA ID, Ayushman Bharat Health Account ID. It ensures data availability and continuum of care, ensuring linkages in between the facilities. Recently, Ayushman Bhava initiative has been launched to saturate all healthcare services in every village, town, to ensure reach to the last mile and enable access to healthcare services to everyone in the society. Dear colleagues, India repeats its dedicated commitment to the prevention and control of NCDs and expresses deep appreciation for the global efforts in this crucial domain. Aligned with India's G20 presidency theme of One Earth, One Family, and One Future, addressing the challenges posed by NCDs necessitates robust and strategic leadership, cost-effective interventions, and a multi-sectoral approach. Enhance the visibility of these efforts is critical in community participation, emphasizing the collective responsibility in the fight against NCDs. In the spirit of One Earth, One Health, India emphasizes the need for nations to collaborate and share successes. It underscores the interconnectedness of global health, advocating for a collaborative approach where countries work together to collectively address the challenges posed by NCDs. This collaborative effort reflects the broader ethics of unity and shared responsibility for the well-being of our global community. Thank you so much. Dhanyavad. Jai Hind.
Honourable Minister, thank you so much. Please show your appreciation. Thank you so much. So much really encased in that message, the key phrase which really stood out, making sure that nobody gets left behind. It doesn't matter whether you live in a rural community or an urban community. It's the concept of good health availability to everybody and also embracing technology to make the differences happen. Hold those thoughts, because what I'm going to do now is to introduce some of our guests. In fact, the guests who are here physically, because some of our guests will be joining us remotely. Could you please welcome Dr. Rupinder Singh Dhaliwal? Let me tell you a little bit about him as he comes to the stage. Please do greet him. He is the Scientist G and Head of Non-Communicable Diseases Division of the Indian Council of Medical Research. Thank you so much for joining us. Can you also please welcome Mallory Kalkani, who is Head of Digital Life Care at Dell Technologies. I'm sure we're going to have a very involved conversation about technology. There's a lot of passion about this subject. Can you please also welcome Mukul Bola of the Defeat-NCD partnership, okay? We owe you a great deal as well, because I know that you and your team have spent many, many months bringing us all together. And let's extend the welcome to Dr. Svetlana Axelrod of the WHO. Thank you so much for joining us. It's good. I'm going to do the elbow thing, because I've also got an NCD, unfortunately. But look, let's focus on the issue in hand, because we've heard those remarks from the Honourable Minister. And what I want to do now is to hand the floor to Dr. Rupinder Singh Dhaliwal. Just to give you an idea, I'm going to ask you a question. I'd like your response to this question. I'm going to give you 10 minutes. But I'm also going to give you a 2-minute alert, okay? And my question to you is the following. From your experience, what do you see as the burden of diabetes and other NCDs in India? And have you noticed regional and socio-economic differences in your analysis? So you have 10 minutes. I will give you a 2-minute warning. Thank you.
Thank you. Thank you. From the Indian side, I think recently, last year, this year, study was published in the Lancet, the INDAP study, that is the India Diabetes Studies. This was one-of-a-kind study which ICMR had funded, which has covered all the regions, all the geographic regions of the country, all states of the country, and has taken a representative sample for each of the state, and taking into account the geographical, the population, and the socioeconomic factors as part of the sampling frame. It was quite a detailed methodology to how to select the samples. So they've taken 4,000 samples from each of the states, which gives national representation to whatever the findings of this study are. And this study has primarily looked at, it was a diabetes study, so it looked at diabetes as well as pre-diabetes, which is something which is quite difficult to do in a community-based setting. So because they did the glucose tolerance test for all the patients which were enrolled in this study. And along with diabetes and pre-diabetes, they also looked at the prevalence of hypertension, the obesity, both generalized and abdominal obesity, because abdominal obesity is more of an Asian feature and is very closely associated with most of the metabolic disorders that we see. And they also tried to find the prevalence of hypercholesterolemia by doing blood sampling in every 5th individual that they came across. And what this study has highlighted is that, yes, diabetes, both diabetes and pre-diabetes are a major issue, both in the rural as well as in the urban area. The diabetes overall prevalence was around 11.5%, but the range is something which is more important, because it ranges from just below 5% to almost 26.4% across the different states. Depending on their socioeconomic development of each state, the prevalence of diabetes has varied, and this 5-fold difference in the prevalence is something which the policymakers and the planners have to take into consideration when they are planning the health services for a particular state. The pre-diabetes also has a similar range of just below 7% to almost 31%. Again, depending on the socioeconomic status and the development, most of these pre-diabetes, which is the highest, is around 31% in Sikkim. These are at least half of them, or 1/3 of them, are likely to convert into diabetes within the next 4 or 5 years. So that's additional burden of diabetes which will be coming into the health system, which all the health planners have to take into account when they are planning for it. Hypertension prevalence is around 30-35%, which is more or less, which is seen in most of the places. That is 1/3 of the population is hypertensive. But again, the range is 25% to 50%. So again, this wide difference in the prevalence of hypertension across the country is again an important aspect for the policymakers to take into account. But other than the prevalence of hypertension, I think what is more important is that at least half of these people were not even aware that they have hypertension. So these were newly detected hypertensives during the course of the study. For the diabetes also, it was a similar thing, that most of the diabetics were not even aware because that they have diabetes. Only when it was tested that they discovered that they are diabetes. But for hypertension, what is even more important is that even those people who knew that they had hypertension, only 50% of them had gone in for treatment. 50% of the people feel it's a slight rise in the blood pressure, I don't have any symptoms, so I need not go in for treatment. And that's again a very important aspect, because some of these are likely to land up with the complications like stroke or myocardial infarction later on, and thus increasing the burden on the health systems, because the health systems have to finally take care of all of these individuals. And even those who start their treatment, only 50% of them are actually, they show that their blood pressure is under control. Because most of the people do not feel that it is necessary to visit a physician regularly to get their blood pressures checked regularly, and if required, change the dosage, because many of the people have that feeling that once they have started the treatment, any drug has been given, they just have to continue the same without changing it frequently. So that's another important aspect which the policymakers have to take into account, that to ensure or to increase the awareness that all the individuals with these NCDs have to be on a regular checkup and a regular follow-up to ensure that they don't land into secondary complications and there is secondary prevention to decrease the load on the health systems. In addition to this major study which was focused on the NCDs as such, ICMR also conducted another study on the risk factors for the non-communicable diseases, which was done again in 2017-18, just a few years back. And that focused on the prevalence of the risk factors in the community. Again, most of the risk factors showed a very high prevalence among the general population. Tobacco use was almost 1/3 of the population had tobacco use, but what is more important is that only 10% of those were actually smokers. 22% of those were the users of smokeless tobacco. Now, smokeless tobacco is something which is not much prevalent in the Western world. It's an Asian feature, more of an Indian feature. India, Bangladesh, Nepal, Sri Lanka, these are the countries where it is much more prevalent. And it carries most of the similar complications that we see in smoking, except for lung cancer, which is lower. But then the chewing tobacco or the smokeless tobacco increases the risk of oral cancers many fold, which is why oral cancer is one of the commonest cancers that we see in India. So this, again, has to be taken into consideration. And among the other risk factors, physical inactivity was almost 50% of the people did not have adequate physical activity. Even among the rural areas, which is primarily an agriculture-dominated society, where we expect that most of the individuals would be doing heavy physical labor, which should account for the physical activities. But with the recent advances and mechanization of most of the farming activities and the relative prosperity that has come because of the Green Revolution, most of the individuals who are the actual farmers, they now do not tend to indulge in the physical labor. Rather than they employ other people to do the physical labor for them, and hence there is a very low level of physical activity that is even in the rural areas. Other than adults, even the adolescents, whom we expect to be much more physically active, this study found that almost 25% of the adolescents did not have enough physical activity to
2 minutes on your presentation.
to protect them from the NCDs. Other than that, the major risk factor which showed a very high prevalence was the use of fruits and vegetables in their diets. Almost 98% of the individuals which were screened did not have adequate amount of fruit and vegetables. Because India, as such, we have just 3 meals a day, and usually only 1 meal is which has vegetables, and fruits are usually taken as mid-meal snacks or something. So there is not a very high prevalence or a custom of using fruits and vegetables that much. And another thing which this study highlighted was that the composite risk factor, that is almost 40% of these individuals had not one risk factor, but at least a conglomeration of 3 risk factors or more, which put them at a very high risk of developing cardiovascular diseases, which was almost 10 to 12% over the next 10-year period. So the cardiovascular risk and whatever they will have will again put the burden on the health systems. So I think I rest my case here.
Thank you very much for that. Please show your appreciation to Dr. Dhaliwal for those findings. I mean, so much to unpick on that, and we will look at these in more detail, but also I'm sure that some of our other speakers will also explore those themes. Let me just introduce you to them, because over there in the right-hand corner, the bottom right-hand corner, I'm sorry about the hesitation, but I do get my left and my right side mixed up, is Dr. Roderico H. Offrin. It's very good to see you. We will speak to you in a few moments, and over there on the left-hand side, I've got that right, is Dr. Nitya Khemka. So look, this is a big subject. We actually had the, if you like, the data case that was brought out there in that presentation, which also presents questions about itself. For example, there's one generation perhaps more likely to follow up treatments than another. But before we do that, okay, in fact, it might be addressed by Dr. Offrin himself, because he's joining us remotely, as you can see. I believe you're in India, is that correct?
Yes, I am, Juliet. I am in Bangalore.
Fantastic. Well, look, it's very, very good to see you. Just to tell our audience a little bit about you, Dr. Offrin is the World Health Organization representative to India. And you know the format. I'm actually going to put a question to you. Again, you have 10 minutes, and I will tell you when you have 2 minutes remaining on your answer. But given everything that you have heard in that first presentation, and indeed from the remarks from the keynote speaker, what do you regard as the priorities of the WHO in India to support the government of India in addressing the burden of NCDs at primary care level? Because what we've heard is the enormity of the task, but at the end of the day, the determination of the Indian government to embrace radical measures, including the use of digital technology, to actually tackle the question. You have 10 minutes, sir.
Thank you, Juliet, and good evening to all the colleagues in the panel and your audience there, and of course to the Minister of State, Dr. Bharti Parveen Pawar. To your question, well, when you work in India, you work to scale. You don't work to scale up. I am not daunted by any of these big goals, as many other countries do step back when they hear these goals of 75 million by 2025. I think it's important to look at what are the domestic investments to primary health care already described by the Minister of State. A robust investment in health system strengthening with a health insurance scheme for 500 million people at least, covering 500,000 rupees, 160,000 or so health and wellness centers. That will be your point of operation. A mission for the second level higher care of health infrastructure mission. That is the entry point. That is what we need to leverage as partners to get to addressing the care that is required for NCD. Identifying them, managing them, tracking them, and of course the larger space of preventing them. I think now let's go to priorities. That goal was not set up with on a whim. It was because there was an initiative called the India Hypertension Control Initiative that was started with Ministry of Health, ICMR, with a partner of Resolve to Save Lives, thinking how do we really address this problem of a very simple disease of hypertension and diabetes. How do we identify it easily? How do we manage it and track it? So 5 components were there. A simple protocol, a team approach at the community-based level, at primary healthcare level, a way to solve system issues such as supply chain issues, a digital support system around tracking and counting, and of course a people-centered services. You have to engage the patient themselves. So this was the initiative that started in 2018, disrupted by the pandemic, and even with that, today, but by the time the pandemic ended, we were able to cover more than 6 million hypertensives and diabetics in 26 states. It received the UN Interagency Task Force Award for Primary Healthcare. And we're very proud to be associated with that. But it's going to the next level. The next level is doing it large scale through the system nationwide. So it's shifting the lessons from that initiative to the system, which is now moving to a larger application. I think Malyari will tell us more about that, the NCD portal, the Comprehensive Primary Healthcare Portal, which is in all health facilities. Our role is also supporting that shift, because I think if you want to scale up, what WHO is providing is also people on the ground. We have 40, what we call them is cardiovascular health officers or NCD officers to support the states in solving these supply chain issues, training for the protocols for hypertension and diabetes, and of course, running through the whole process each time so that everyone is comfortable with enrolling a patient, managing the patient, tracking, following up so that someone who is on treatment doesn't fall off from it. Part of the priority also is to strengthen teleconsultation via the digital platform of telemedicine called eSanjeevani. At its peak, the eSanjeevani system was able to handle 510,000 consults in one day. The system is able to take 1 million consults in a day. And since it started during COVID, it is now 125 million consults. So it is sometimes used as the first screening so that you are referred properly to the next doctor, which we see happening in these primary health care centers or the health and wellness centers. If the case is a bit complicated, you have an appointment from the health and wellness center through a telemedicine consult for your more complicated case, probably of diabetes and hypertension. So it's leveraging, again, technology, but making it very accessible so that the person doesn't have to travel far to get a higher referral. Strengthen the referral linkages. This is key. So making that seamless. It's not as if, and sometimes that may be happening, but that's slowly part of the shift to get to 75 million by 2025, is that every patient who comes to a health and wellness center is your patient from start to finish, even if they're referred to a specialist up at the district level or a tertiary capital. And lastly, the now embedded principle, and we are working in 5 states covering 13 districts. emphasizing continuum of care for NCDs. Many diseases are not mutually exclusive. So it's important that that person is treated as a person. We also help health and wellness centers officers to look at opportunistic screening. A TB patient may have hypertension. A hypertensive patient may have TB. A diabetic patient may have TB. A TB patient may have diabetes. These comorbidities exist. And so following them through so that they are able to heal well and get cured is part of that continuum of care project, which NORAD, the Norwegian government, has kindly supported us with funds in this. And it's really working well. So part of Scale Up, leveraging the system, also includes a shift in the care, really looking at that continuum, whether that continues at primary healthcare level or through the district health system at a higher secondary or tertiary level. That should always be how a patient is connected. I think the supply chain issues are really key. That's what solves most of the problems. And that is also the cause of many problems if we are looking at continuum of care and treatment. But all in all the elements that are required to scale up and reach 75 by 25 are within the health system of India. And so we are moving towards that as a WHO country office for India, present in these specific states, providing both technical and operational support. Thank you.
Thank you very much, Dr. Rodrigo H. Offren. Thank you for a comprehensive analysis there of the approach that needs to be taken given the enormity of the task. But again, and I'm looking at this as an outsider, it's the idea of somehow being holistic, and that yes, you can identify an NCD, but remember that even if you're treating it, you use the example of something respiratory, there could be other factors connected to that as well, and it means engaging people. Geographically, you have to engage them, and culturally as well. So again, a lot there, but it comes back to the D word, digital. And Malari Kulkarni, this is where you come into the conversation. Now, Malani is head of digital life care at Dell Technologies. Thank you so much for being here, because I know that you flew in from India. Was it today or yesterday?
Yesterday.
You flew in yesterday, so you've had your hands full. But look, again, you know the drill. I'm going to put a question to you. You've got 10 minutes, and I will alert you when you've got 2 minutes left on your time. But we've heard about the task, okay, the numbers, okay,
yes,
and this generational problem. This has been going on for decades, okay, the holistic approach, how you have to reach out to people. But from your perspective as the technician, how do you think partnerships for inclusive digital technology can actually help manage and control NCDs in India? And are there concrete examples that you yourself have come across which can really set the benchmark for this, the direction in which we should be heading? 10 minutes, and I'll tell you when you have 2 minutes left on your presentation.
Okay, thank you. Good afternoon, everyone. Hey, Malari Kulkarni. I'm working as a director at ESG, Environment Social Governance Group within Dell Technologies. Okay. First of all, it gives me a great pleasure to be among such an eminent panelist, and thank World Health Organizers, especially M8 Alliance and Defeat-NCD, for inviting Dell Technologies to provide my perspectives. Since from 2018, Dell Technologies had the privilege of being a technology partner for Ministry of Health, Family and Welfare, Government of India for National NCD program, along with Tata Trust as a program management partner. See, at Dell, as part of our ESG priorities, okay, we invest in innovation, partnerships, and initiatives that apply our technology, scale, and talented workforce, okay, to solve complex societal challenges like circular economy, okay, or inclusive workforce, digital divide. There are many challenges in the world, so that's what we try to do it. Now, at Dell, we are also committed to transform 1 billion lives through digital inclusion by 2030. Dell has developed a platform called as Digital Life Care on a pro bono basis, okay, mainly for Government of India for National NCD portal. This is a signature digital inclusion initiatives truly led by Ministry of Health and other strategic partners like NHSRC, Dr. Arfin from WHO India, AIMS, ICMR, NIC, and many more. Honorable Minister Dr. Bharti Praveen talked about the National NCD portal. I'm going to talk about that, what exactly it does it. By working with Government of India over the last 5 years, I'm going to cover 3 key points. What is the NCD digital solution? How it is helping improving the NCD management at scale, and in terms of, as on today, the program, how much it has achieved, and what are the critical success factors. To talk about the digital solution, the National NCD portal, built for National NCD program, consists of web and mobile applications, and even the dashboard designed for community health workers like doctors, A&M, ASHAs, and the program decision makers, all integrated into a single unified platform, okay, with a single source of truth. That's the key message here. Now, along with that, it is also built on a federated architecture principle, because some states may have their own custom homegrown solutions. So if they have the custom homegrown solutions, they can send the data back to the National NCD portal, because end of the day, health is a state subject. So that's we all need to remember that. And let's take a look at it, how technology is solving the key problem. See, today, NCDs are silent, chronic, and there's also a low health seeking behavior with the citizens, especially in rural areas. Because of this, there's a high chance that the people may fall through the crack and they may not continue the NCD management. Remember one more thing, the NCD management requires a lifestyle changes for lifetime. Now, to solve these challenges, the technology provides some kind of alerts and reminders to both the healthcare workers and the citizens, ensuring that their care journey is managed very effectively and easily. In addition to this, the NCD portal also provides you kind of a dashboard starting from national level, state, district, taluk, and villages with a single source of truth. So when you provide a single source of truth, what happens is the data decision making becomes unified for common goal. So that's what is going to happen. Let's talk about the NCD impact in numbers. Honorable Minister talked about it is a population-based screening program, age above 30. Okay, so that leaves with the problem of like a mighty challenge of managing millions of citizens' data. Okay, so as on today, the National NCD portal has 460 million people are enrolled in the system, 160 million people are screened, 60 million national verifiable digital health IDs are issued under India's digital health mission, and we all talked about 75 by 25. 75 million people should be on treatment by 25. As on today, 11 million people are already on treatment. And in addition to this, 225 million users are onboarded, trained, mainly doctors, nurses, A&M, ASHAs, and decision makers are trained and onboarded in the system. The numbers are mind-boggling. If you look at the overall, what is the key objective of the digital solution? It has only three things. Provide continuum of care. Okay, that means create a longitudinal health record starting from the enrollment at the lowest level to the treatment, number one. Second, increase the productivity of the healthcare providers. How? By sending alerts and reminders and work plans. The third one is enable the execution at scale. It means providing a dashboard access, data access to all the stakeholders in the system. Let's take a look at what are the critical success factors. Okay, this kind of a transformation happened. First thing is, the government has designed the program, defined the policies for the 4 national NCD portals, number one. Second, it has also defined the policies for procuring the hardwares and training the thousands of healthcare workers. In addition to this, government emphasizes on building a robust IT system as per the national health policy. Coupled with this, government also identified the key partnerships, like Dell Technologies as a technology partner. What we bring? We bring our talented workforce and the scale, okay, with a clear objective of transforming 1 billion lives. So that also complemented it. Tata Trust, which is the program management partner, what they bring on the table, They ensure the technology adoption and quality implementation at the scale across the country. So this is one. Let's take a closer look. Other than that, like strategic partners like NHSRC, WHO India, ICMR, AIMS have contributed immensely to make this successful. If you look at key technologies, I want to call it at least 4 to 5, why it really transformed. First thing is comprehensive design and development of IT solutions with offline first approach, because in rural areas, there may not be network connectivity. So to address that challenge, we built an offline first approach. That's one. Second thing is the platform is secure, scalable, and interoperable. It means it is getting integrated into all other health systems within the country. Third, easy to use platform applications and designed in 11 local languages. Okay, so that the ANM and ASHAs can also interact with the local languages. The other two important are basically the training model is basically train the trainer approach. Like Tata Trust trains the state official, state trains the district, and further that. Coupled with digital training methodology, accelerated the adoption. The last one, the important thing is the center and states goes in a campaign mode. Whenever they go in a campaign mode, providing that kind of a data much more quickly, the agility of the software to turn around and release the information really help the transformation. In conclusion, is this model replicable in other countries? Absolutely. How? 3 important things take away. First thing is strong government leadership and collaborative ecosystem is very important. Scalable platform with the architecture, with the interoperable of data, that's second. Third one is the program management, which makes it, for example, ensuring the technology adoptions and the quality implementation and the ground. If these 3 are available, this model can be successful in any country.
Okay, thank you very much for that, Mulkani. I think also as well, the key to this is to choose your digital partner carefully as well, because we've often found, not necessarily in the health sphere, that you have particular practitioners in one industry teaming up with digital companies, and something hasn't quite connected, something's gone wrong. So you have to actually approach this from a shared purpose. Otherwise, the losers in this will be the very communities that you will be trying to help. But look, we're going to address some of those issues a little bit later on. Let's now move on to the final member of our panel, in fact, joining us remotely. And this is Dr. Nitya Khemka. Let me tell you a little bit about her. She's Director of Strategic Initiatives and Global South Partnerships at PALTH, which I mentioned earlier. She's also a Cambridge University Fellow and a member of the Defeat-NCD partnership. Now, are you in London or Cambridge? Can you hear us?
Yes, hi, I'm actually joining you live from India, so...
You're actually joining us live from India. Do you know what? It doesn't matter where you are joining us from. It is good to see you, and we appreciate the fact that you're here, because I know that you are very, very busy, like all of our panelists, but thank you so much for being here. I think you know what the drill is. I'm going to ask you a question. I'm going to give you 10 minutes, and when we have 2 minutes left on your allotted time, I will let you know. But listen, you have been following everything. You've heard the minister's address at the very beginning. You've been hearing from our other panelists. And given everything that you have heard, in your opinion, what do you regard as some of the most innovative partnerships to accelerate health equity that you've seen, not just in India, but in the global south? You have 10 minutes. I will alert you when you have 2 minutes left on your presentation. Thank you very much.
Thank you, Juliet, and good afternoon to everybody present. Respected Minister of State, Government of India, Dr. Bharti Praveen Pawarji, Excellencies and colleagues. It is a real pleasure for me to be with you today, even if it's virtually. Last month's Anga highlighted a stark reality. The world is falling short of achieving UHC by 2030. It is a sobering fact that over 4.5 billion people lack comprehensive access to essential health services, and that 2 billion people grapple with financial hardship after accessing life-saving health services. Yet, the majority of essential UHC interventions can be delivered through a primary healthcare approach. As Dr. Tedros emphasized last month at Anga, primary healthcare remains the most inclusive, equitable, cost-effective, and efficient path to UHC. Today, I'd like to talk to you about some innovative partnerships in health equity emerging out of India. A lot of the examples are from the excellent work done by the Ministry of Health and Family Welfare, Government of India, along with other organizations such as the Defeat-NCD Partnership and PATH, which is a global health NGO with more than 40 years of experience in addressing the world's health inequities and strengthening primary healthcare systems. The path to achieving the holistic goal of UHC and combating NCDs hinges on collaboration, where all the key industry stakeholders, the funders, the governments, policymakers, the innovators can really come together to deliberate, to cooperate, and to work in tandem to bridge really the vital gaps in healthcare service delivery. The promise of innovation and bringing them to scale can help us achieve widespread, lasting impact, and the power of partnerships can help get us there. Collaboration and people-centered solutions ensure that the focus remains on individuals and communities, leading to more effective, sustainable, and equitable health outcomes. In the Indian state of Maharashtra, PATH has partnered with local government to expand high-quality primary healthcare with a focus on chronic diseases, which account for over 6 out of 10 deaths in India. We are doing this by focusing really on early detection and management of NCDs, such as diabetes, hypertension, cancer, breast, oral, and cervical, and COPD, and supporting in population-based screening endeavor of the Government of India under the Ayushman Bharat scheme, which we've heard of from the minister, which is really the world's largest government-sponsored healthcare scheme. We are at the forefront of accelerating progress in NCD detection by pioneering numerous innovations to ensure that NCDs are detected and treated as early as possible. And this includes things like low-cost AI-powered stethoscopes to better detect heart and lung disorders, including in far-flung communities where health services are unavailable. We are also deeply aware that people with NCDs tend to face multiple health issues, including higher rates of mental sickness than the general population. This is why we have facilitated regular peer support groups for people living with NCDs, which can foster social connectedness and improve adherence to treatment. Moreover, PATH has positively influenced local policy in Maharashtra by advocating for a broader essential primary healthcare package that now includes things like snake bite prevention and management services. In partnership with local government, we are firmly committed to reversing these trends through culturally appropriate, people-centric, and evidence-based strategies which acknowledge that public health issues are often multifaceted and that silver bullets do not exist. In India, PATH has successfully and swiftly mobilized resources, expertise, and key stakeholders during health emergencies. At the height of the COVID-19 pandemic, PATH partnered with 24 states to help maintain uninterrupted oxygen supplies in healthcare facilities across the country. We achieved this by developing a landmark O2 digital suite, a granular and user-friendly online dashboard. Our dashboard tracked and integrated real-time data from 2,300 pressure swing adsorption oxygen tanks, 53,000 oxygen concentrators, 650 liquid medical oxygen tanks, and 300,000 oxygen cylinders. PATH is actively engaging with numerous digital health initiatives in India, including, as the Honorable Minister mentioned, the government's landmark eSanjeevani app, which is now the world's largest national telemedicine service. Since eSanjeevani was born, a stunning 160 million people have received health consultations from the comfort of their homes. Every day, eSanjeevani serves about 200,000 people. And we are confident that in the long haul, innovations like eSanjeevani will really help India achieve its bold target of offering standard care to 75 million people with hypertension and diabetes. More broadly, the government is now working to position eSanjeevani as a digital public good so that the rest of the world now can harness its potential. At PATH, we firmly believe that digital health is a crucial tool to enhance health systems, facilitate remote healthcare services, strengthen health information systems, and promote interoperability of health data. It can expedite our efforts to move towards UHC and to achieve the health-related SDGs 2030. When fit-for-purpose digital innovations and technologies is used to address public health challenges, it informs policy change and helps build models of service delivery at population level, thereby enabling UHC. However, we must work hard to ensure that digital health initiatives do not perpetuate existing inequities and that they actively work to promote health equity. Bharat's work to tackling NCDs and promoting UHC in India goes far beyond reducing the burden of chronic diseases, expanding primary healthcare, and engaging with transformative digital health innovations. PATH has also helped develop and roll out life-saving, locally produced and low-cost vaccines. We have sealed numerous innovative partnerships that have supported vaccine manufacturers from clinical trials through to WHO pre-qualification. This includes a heat-stable pentavalent vaccine developed by Biological E, an India-based firm. In just one dose, the pentavalent vaccine protects children from 5 life-threatening diseases, which also minimizes environmental impact of plastic-based syringes, vials, and needles. Thanks to Gavi's efforts, the Global South will now be able to access the vaccine for just under $1 a shot. This is 3 times cheaper than it was a decade ago. 13 years ago, PATH set out to combat one of the deadliest diseases in Africa with the Serum Institute of India and with funding from the UK government's Foreign, Commonwealth and Development Office. This partnership has borne its fruits, culminating in the development of the MEN5 vaccine. This is a game changer for meningitis and it is now WHO pre-qualified. MEN5 is the first vaccine to protect against the 5 major drivers of meningococcal meningitis in Africa. This includes meningococcal group X, which is a growing concern in the region. MEN5 is affordable and heat stable, allowing it to be shipped to remote communities that would otherwise be left out. This vaccine is a pivotal step towards protecting the 450 million Africans at risk of death or severe disability due to meningitis. It will also advance our efforts to defeat meningitis by 2030.
2 minutes on your presentation.
Thank you, Juliet. As the world moves past COVID-19 and prepares for future pandemics, we must ensure that the principles of equity and access are built into partnerships between governments, the private sector, and civil society organizations. This will help ensure equitable access to life-saving medical technologies like vaccines, treatments, and diagnostics for anyone who needs them anywhere across the globe. In the words of Dr. Tedros, UHC is a political choice that member states must champion. But they cannot combat NCDs by working on their own. Robust partnerships with multiple stakeholders are pivotal for combating NCDs to become a reality. However, for these partnerships, I think, to succeed, they must be culturally appropriate, people-centric, and ensure that they leave no one behind. Thank you very much.
Thank you very much, Dr. Nitya Khemka. And in fact, what I would like to do is to extend the applause to all of our speakers, regardless of whether they're here in person or remotely, because I think what they've done is to really highlight the scale of the challenge in India and the incredibly innovative way that the government is trying to approach this, but importantly, the lessons that the rest of us can learn. It doesn't really matter whether your country is in the developed half of the world or what. NCDs are dangerous, they have an economic impact, they have a social impact as well. So thank you so much for sharing all that. In fact, I think you've all done very, very well. But we haven't quite finished speaking yet, or rather I have. I'm going to rest what's left of my tonsils for the moment, because in fact, I'm going to hand you over to Mr. Mukul Bowler, our gentleman here. Now, he's the Director Division on NCDs, Digital Health and Capacity Building at UNITAR. And I know that this is a subject, well, you and I go back a longish way, and your passion for making a change, for really highlighting what is happening here, it has not diminished over time. I feel in some ways we've been on this journey together, and I'm now going to hand things over to you.
Thanks, Julia. Well, thank you, distinguished guests, speakers, partners, and friends for joining today's session, both in person as well as online. And it's, I'd like to extend my strong appreciation to the World Health Summit organizers for providing this inclusive platform for the 5th consecutive year, and our co-hosts, the Government of India and the Defeat-NCD partnership, for putting together such an impressive program. It's notable to see the increasing number of students participating at the World Health Summit, both in person and via live streaming. And I encourage more academic institutions to engage with the World Health Summit to further extend this learning opportunity to the emerging public health talent globally. We've heard the G20 presidency in 2023 illustrates a country's continued commitment to working together for a healthier future, and the government's commitment to scaling up integration of NCDs in primary care is evident with its bold target of reaching 75 million people with diabetes and hypertension by 2025. We've also heard from the speakers examples of how identification of needs articulated in sound multi-year evidence-based research conducted across the length and breadth of the world's largest country inform bold political action and has as a basis strong political and programmatic commitments, which can be truly transformational at scale when combined with context-appropriate technological solutions built on the enabling infrastructure and necessary maturity levels. These examples of collaboration between research institutions, public and private and philanthropic sectors, and technological partners to serve other countries through South-South cooperation provides hope and learnings in terms of practical solutions and opportunities for accelerating action on NCDs. It's important to recognize that, like Rodrigo was saying, the amount of investment that countries like India have actually put into tackling some of these solutions is enormous. It's important to recognize that solutions like the NCD portal developed with the Ministry of Health, Dell Technologies, and Tata Trusts takes sustained effort, requires an enabling environment. It's not simply enough to plug a technology solution to an identified need. There's no quick fix solutions around this. And to provide context, Malari mentioned, 6 years of work in terms of bringing this solution, at scale across India. So we're very excited about how this can be actually, our partners, Dell, can actually use some of this information and the government of India to actually roll it across some of our other program countries across the world. This has got to be combined with strong focus on continuous learning and knowledge sharing. India's embarked on a strong program of upskilling workers across government, the largest employer, through its Mission Karam Yogi, or the capacity building program. This program has already developed annual capacity building plans across 93 ministries, departments, and agencies, including the Ministry of Health and Family Welfare. And within the framework of the Ministry of Health and Family Welfare's annual capacity building plan, launched earlier this year, and the National Program for Prevention and Control of NCDs, UNITAR, along with WHO, Rodrigo's team in India, and the Defeat-NCD partnership, is supporting the Ministry of Health and Family Welfare in designing the modules and delivering the training of some 40,000 primary healthcare medical officers on standard treatment workflow for NCD services, with an objective to increase the NCD-related services at primary healthcare level. Youth and research have a key role to play in accelerating change. Many of you have participated in our session last year, where Svetlana and I and the team behind her, Thea, Daria, without whom none of this would be possible, really, where we presented awards to 8 finalists from low and middle income countries to undertake implementation research on NCDs. So now it's my pleasure to present alongside WHO's Svetlana Axelrod the results of the work undertaken by the 8 researchers that were awarded these grants under the Young Researchers Program established by Defeat-NCD Partnership, WHO, and UNITAR. There are some hard copies of the policies briefs prepared by the grantees circulating in the room, and they shall be posted online on the WHO, Defeat-NCD, and UNITAR websites shortly. But they include really, I welcome you to actually have a look. They include effects of mobile phone-based self-management, educational interventions on quality of life of patients with COPD, addressing the double burden of diabetes and tuberculosis in Uganda, using a participatory approach, improving the prevention and management of non-communicable diseases in Ethiopia, smoke-free legislation and enforcement in China, recognizing the uneven process, assessment of the implementation of the Changing Diabetes in Children program in Cameroon, towards meaningful engagement of people with lived experiences and policy decisions, the case of diabetes in Peru, implementation of the WHO integrated care for older population framework at primary healthcare in Egypt. Remarkable piece of work, really, that has come across from all different parts of the world by young researchers over the course of the last year. So without further ado, let me hand it over to my colleague Svetlana Axelrod to provide some more information on the Young Researchers Program and show us a small video on this as well. Svetlana, please.
Thank you so much, Mukul, and it's a great pleasure to be here again after 1 year. I will also take the stage because I have a couple of slides.
He's vacated it just for you.
Don't say so hard.
Thank you so much.
Okay, so thank you very much, and I'm really very happy to be here again. 1 year passed so quick. And so many familiar faces and colleagues here in the room, and it's a great honor to be again here and to say a couple of words about our young researchers that Mukul already said. This is a great partnership between World Health Organization and Defeat-NCDs. But first of all, saying that today we have so distinguished guests from India, I would like to take the opportunity and to say the big thanks and for the support that we had during the UN General Assembly for the government of India. We had the annual meeting of the Friends of the Task Force, where we have the award ceremony from the WHO and from the DG of WHO, Dr. Tedros, for the 9 winners who were selected for the best winners from the health sector, non-health sector, and NGOs in their programs for digital health and NCDs. And it was the joint event that we had with the WHO and the government of India, and it was really a great opportunity for us to see how the digital health could be invested in the prevention and control of NCDs. So that's where I want to start. I have a short presentation that I will go very quickly. And as Mukul started and said that today we will quickly look how we did this young research program and what is our next steps and how we can developed on. So, as you know, the non-communicable diseases is the biggest killer, and I see Dr. Benton Nicholson here is us with the room, the director of the NCD department from the headquarters of WHO with her colleagues, and of course, Bente will have the opportunity to present the all burden of NCDs here during the World Health Summit. And but very important, how we can involve the young people, the young researchers, especially in their role on the prevention and control of NCDs. And that is one of the important role that we are keeping on the global NCD platform department in the headquarters. We do it with different partners, and one of our partners is Defeat-NCDs, and Mukul is supporting this program from his end. And it is very important that the objectives of this is to give the new opportunities for young people to build their capacity in the young researchers, to encourage innovative research, to scale up implementation research in low and middle income countries, and of course to strengthen the multi-sectoral engagement and investment for the NCDs. So let me go back and to remind you about our event which happened last year here in the same room. And we've got awards for 8 young researchers from all the regions and countries, and all of them were invited to be here at the World Health Summit. 7 of them were here with us in present, and 1 was, I remember, remotely. We take the photos, and of course the DG provided this award to these young researchers, and it was really a very great opportunity to say, and the DG mentioned that how it is important to have the young people involved in the NCD agenda. So here is the slide where our winners were from. Yeah, you see these countries, regions, and it was these memorable pictures. And the most important, how we will proceed. This is the slide where we show the next steps. And you know what I have mentioned just now? That me, myself, and Mikul, we are both in the purple color, and the presentation is also on this. So I think it's something specific that we have to keep this color as a next our movement process. So the most important is, of course, to engage the young people and to increase their outreach for the youth across the globe, to build the capacities of young researchers, and of course to invest to this. We are very happy to continue this process, and today we will have a chance to see the short video about these young researchers that we've developed.
You've done it, so well done. I think that deserves a round
Thank you
of
so
applause.
much, and thank you, Julian, for your fantastic moderation.
Well, and thank you so much for being so beautifully colour coordinated. You know, speaking for the 3 of us who aren't wearing purple and pink, you know, we do feel a little bit left out, but we'll know better the next time around. But you referenced that video, and what I'd like us to do is to play that video now, because it's not just acknowledging what these young researchers did last year. Many of you were here when they took the photo calls and they received the grants, etc. Remember, they are putting down the steps towards the future. So if you like, we're looking at the roadmap going forward. Can we run VT, please? Thank you.
The global burden of non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, and mental health conditions are disproportionately affecting low and middle income countries, especially when it comes to premature mortality. The risk factors of major NCDs are associated with behaviours that are established during adolescence, including harmful use of alcohol, tobacco use, sedentary lifestyles and unhealthy diets, exacerbated by social, economic, environmental, commercial and political determinants that create unhealthy environments. The good news is that young leaders have an enormous potential to transform the fight against NCDs on a global scale. Youth involvement presents unique opportunities to influence processes and decisions that directly affect them, and makes it possible to initiate lasting positive changes to improve health and prevent diseases. To build the future public health leaders' capacity and ensure their engagement in NCD prevention and control, the WHO Global NCD Platform and the UNITAR's Defeat-NCD Partnership, in collaboration with other partners, established a Young Researchers Programme. The programme offers incentive grants to researchers to focus their efforts on the achievement of NCD and other health-related targets of the 2030 Agenda for Sustainable Development.
On research, we established a grant programme for young researchers from low and middle income countries on NCDs. 8 were chosen from Cameroon, China, Egypt, Ethiopia, India, Peru, and Uganda.
The Young Researchers Programs of the Global NCD Platform empowers future generations of global health leaders by supporting high-quality research focusing on non-communicable diseases. Research proposals are selected for their high country-level impact with sustainable improvements in health and health equity.
exciting. I hope that we will continue this great collaboration and we will support these young researchers, and they will be also a part of our next meetings, next activities.
Young people make up more than half the population of this world. And I believe it's important for us to bring new ideas.
We, the youth, are the next generation of policymakers, implementers, researchers, and advocates.
Giving the power to the young researchers can create new ideas.
Because working alone is good, but collaboration is better.
The feedback has been amazing from the young researchers. They feel so empowered by the program, by WHO support.
And I'm very pleased to say that this program, this pilot program, is going to be continuing with many more partners hopefully joining.
We believe that partnership in the space is going to be critical in driving resources, but also providing platforms for those young voices and that evidence and those ideas to really flourish and be scalable to solve for this complex challenge.
The Young Research Initiative helps us as well in two ways. On one hand, give us guidance what we can do as health professionals, but on the other hand, I think it's a great opportunity for the young researchers. We can keep them in the area of NCDs.
So there we are, a glimpse into the future and the work that is taking place. I know that some of the researchers are here. I'm not going to embarrass you by asking you to stand up, but could all of you please show your appreciation to these young people for the incredible work that they're doing, from which all of us will benefit in the future. Now, we have a few more minutes left. I know that our panel thought, well, that's it. We said what we had to say. There are no more questions. Well, guess what? You're all wrong. So let me start first with you, Dr. Rupinder Singh Dhaliwal, because look, you know, you outlined the case there, the research that you found from actually looking at NCD prevalence in India. But would you say that overall, that awareness in the general population is weak? And if that's the case, doesn't it perhaps make it inevitable that people will be less inclined to follow treatment programs? Because as you yourself pointed out, there is that danger that you can treat somebody, they feel great, but they're not likely to continue with it going forward.
I think that's where the national program comes in, because one of the mandates of the national program is to increase the awareness. And all of this focus now on health and wellness clinics, health and wellness centers which are located nearer to the home of the individual, and the local health worker has been trained to reinforce the need for continued and sustained treatment. So those kind of, and all of these awareness and all, I think it has to be primarily via the community participation. The government on its own can just send messages and all, but most of the people by nature, I think, are not going to react or act on those advisories whichever are being issued by the government. If it is a person who is living in their community whom they are familiar with, and that person, when they say that, yes, this is something that you should, this is for your own benefit, this is for the benefit of your family because your support would continue. I mean, those kind of culturally relevant messages can only be provided by the person who is living in that community. So I think that is what the government is now trying to harness and use in the form of the community workers, the health workers, the ASHAs and all. And in addition, there are many women self-help groups sort of things, which are community groups, which are also actively working, and they have been also been given the material and the training to increase the awareness among their own communities. So I think
an interesting point there as well, Dr. Rodrigo Offren, because that really touches on some of the points which you raised in your presentation, the fact that you really have to get into the DNA of a community, but at the same time, you mustn't patronize people, because otherwise you risk alienating them and undermining the value of the message you're trying to impart.
Yes, correct. I think it's bringing the community together and imbibe that messaging. I think what Dr. Dhariwal has said is correct. It's really leveraging the ASHAs, the community health workers. They are the most trusted source of information, even during COVID and COVID vaccination. We were working with them to get messages of hesitancy, even now, for other vaccine-preventable diseases. And it's also connecting messages, you know, so you may have a teleconsult, let's say for hypertension, but no one actually asks, are you a smoker? How many do we get off from that habit? We should also address risk factors. What is also interesting with India is the investment in teleconsultation for mental health. And I think I have to put it in here because this is NCDs, not just hypertension and diabetes. The teleconsultations with counselors nationwide have taken off, especially with adolescents. We're also, during the time of COVID, we were training adolescents for COVID appropriate behaviors as well as for promotion of vaccination. So it's leveraging, again, we need to leverage what's there. There is so much there in terms of the solutions that are possible. I think Dr. Dhariwal painted with us the picture of the burden of disease, but we're also here to listen and share what are the solutions that are happening. And it's India with its 37 states and union territories, 777 districts or so. You have a variety of solutions to probably similar problems. So even the intra-country learning, inter-district, interstate is so rich that this is something that is a very important source of knowledge for other countries in the developed world or even the developing world.
Just very briefly, because just listening to what you said, you mentioned COVID-19. You cannot avoid COVID-19 when we have conversations about NCD, but it does sound as if, despite all the negatives, the silver lining to that cloud was that it actually brought health workers and communities closer together. So in that sense, it's actually made it easier to use technologies like the telemedicine, and certainly for the government, to actually get one step closer to that 75-25 initiative. So it's the harvest, the benefit, if you like, to what was essentially a tragic global situation.
Yeah, it was a tragic situation, but the shift towards solutions was very fast. I will tell you that with the India Hypertensive Control Initiative, the shift towards the policy was 1 month of provision of antihypertensives to a patient. It should be shifted right away to 3 months because of lockdowns, because of possible stockouts, etc., that we didn't know, so that someone with hypertension can continue with their medication. So there are many shifts in terms of the solutions that you thought initially were not possible. In fact, maybe we can all learn from that period where inter-sectorally it was much easier to work during the response period than right now. I think we should have to go back and again see the urgency, look at NCDs as a huge emergency that's always been there, quietly growing, and taking out lives, costing the economies of countries, and of course, costing the healthcare system. So yeah, there's still so much learning from COVID, as you have pointed out.
Absolutely, and of course, those lessons will continue as well. So thank you so much for that. Dr. Nitya Khemka, I mean, look, you've heard everything, but there is also a big question underpinning this, and this is government agencies, NGOs, and other key stakeholders. It's how they can effectively collaborate, not just to develop and implement plans at the country level so that they can actually address public health challenges, but also they've got to make sure that you have an equitable allocation of resources and at the same time mutual accountability, particularly to the end users. Now that's a big ask. How do we get it?
That's a very big question, Juliet. But The previous speaker also mentioned reducing the burden of NCDs is urgent and so very critical. The challenge is big and the response, therefore, has to be bold. And to create an enabling environment to reduce exposure to risk factors, empower individuals and communities with the knowledge they need to make the right choices, as well as to provide high-quality NCD services to the people who need them, truly requires a strategic plan that is multi-sectoral. And I would really like to give the example of the National Costed Action Plans developed by the Defeat-NCD partnership as an illustration of what is possible. The Defeat-NCD partnership has been assisting national health authorities in Myanmar, Rwanda, Djibouti, and Gambia in developing a costed and operational action plan for addressing NCDs. And these costed plans have really equipped countries with well-defined cost-effective interventions and provided a pathway to raise both domestic funding and investments as well as engaging with international donors. But what are really the nuts and bolts of actually getting something done? First is enhanced national multi-sectoral collaboration is key. It is only through the involvement of all these stakeholders that this plan will be successful in its mission to alleviate the economic, the social, and the medical burden of NCDs. This includes bringing together different ministries, sports, food and nutrition, health, finance, environment, as well as local government, along with the private sector and civil society organizations and capacity building of frontline health workers across villages, which is very critical. The second is a prioritization exercise to identify clear objectives to steer action on preventing NCDs. Within each of these objectives, the costed action plan clearly identifies expected outcomes, including things like indicators and measures to be tracked. And achieving this finally will require a shift in financing. National budget allocations are often limited, as we know. They're not proportional to the burden faced. So the costed action plan outlines the resources needed to achieve these defined objectives. And this has to happen within budget allocations across government sectors by developing a list of cost-effective priority activities, as well as bringing in new funders and funding innovations. And this will require very close collaboration among different players, including government departments, the private sector, local communities, development partners, etc., to come together to mobilize resources and clearly identify the gaps in need and access. And this whole comprehensive planning at all stages will help strengthen health systems delivery and build strong and prosperous nations.
Okay, thank you very much for that. And also for answering one of the questions which I posed at the very beginning, which was this idea about communities getting involved, because you don't want them to be bystanders to a conversation which is going to impact them. But let's look at the technology. And Malari, this is where you come into it, because look, we've got the prevalence of NCDs, and in India, there is a concerted effort on the part of the government to deal with that. But does that prevalence in itself open the way for so-called disruptive technologies? I mean, it's one of those broad-based terms, but is that something which excites you, that perhaps, given everything that's happened, there's more scope to be more exploratory in slaying this dragon, the NCD, the curse of the NCD?
Absolutely. I mean, as we all know, technology keeps changing. How many have used Gen AI, generative AI? Raise your hands. Chat GPTs. That's generative AI. Okay? So imagine today's what is happening worldwide. The systems are built for all these administrator, doctors or A&M and ASHAs or program decision makers. They get a dashboard saying that, hey, this is your target, these are the things. If this whole thing can be changed to a conversational language, tell me what should I do today, okay? And what are the 5 patients I should attend it? What are the most probably these possible patients? For example, in NCDs, what is more important? Follow-ups and control, bringing hypertension, diabetes control. Tell me the probability that which patients, if I track it, okay, they can succeed better. If this whole thing, the Gen AI, can be introduced to all the healthcare workers and the doctors, then what will happen? They will fall in love with technology also. So, because ultimately the technology should ease the people's burden. Okay? Of course, it requires a huge compute, that's a different ballgame, but again, that also is getting innovated. So, my point of view is that technology plays a very important role and accelerates the transformation much more rapidly because of this Gen AI.
And of course, as Dr. Nitya pointed out there as well, it's also putting in the money, actually changing the architecture in government and also changing the mindset. But look, I think you have all done incredibly well. We had a lot to pack in in a very tight window. So can you please show your appreciation to our guests on the stage and those who are joining us from India. We appreciate everything that you have done, and also for sharing the work of the Indian government in terms of embracing technology, setting these extraordinary goals, trying to make a difference. Remember, the lessons are not just there for India's benefit, but it's for all of us as well. NCDs are a blight on humanity's landscape, but it's not beyond the wherewithal of all of us to fight it and to ultimately win, to produce a healthy population that has a great expectation of a life ahead and that can be economically beneficial and enjoy many of the social advantages that we take for granted. Thank you so much for joining us. I wish you a happy day and enjoy the rest of the World Health Summit. Thank you, and thank you to our guests.